We're here at the Shepherds 360 conference where Dr. Scott RAE gave a helpful presentation on ethical considerations for couples who are struggling with infertility. So Dr. RAE, if I could ask you, what advice do you have for Christians who are considering the in vitro fertilization method as a solution to infertility?
Well, I appreciate the question.
Yeah.
And also it's really clear, I think, that the couple needs to first of all know that you appreciate what they're walking through, the level of pain that this has caused, and to not give them unsolicited advice that may be well-meaning but otherwise pretty clueless. So IVF is considered the default treatment for most cases of infertility that don't have a simple fix. So what they have to be aware of is what happens if it's too successful. That is, they need to know what the standard of practice is and what will happen if they have embryos left over in the process once they are finished having children. The standard practice is that they'll try to put as many hormones in the woman's system to get her to release as many eggs as possible. They'll fertilize them and then see how many connect, and then they'll implant 2, maybe 3 at most at a time.
Okay.
So obviously if they get twins or triplets on their first try, they've hit the jackpot and they're probably done, which may mean embryos left over. So they've got to decide, what do we do if that's the case? And so the options are to discard them, donate them to research, both of which are unacceptable because they end up being destroyed.
Right.
They can put them up for adoption or they can implant them themselves, assuming that they're able.
And you drew attention to those first 2 options where you discard the embryos is equal to abortion.
Right.
Right. And so
Now, if we believe, which I think is right, you have a person from conception forward.
Yeah.
That's a problem.
Yeah. So it's that 3rd and 4th options that you would sort of point Christians to.
Yeah. I think it's better if the couple can implant them themselves. The rule I would put out there is that every embryo created in the lab gets a shot at maturing in the womb. And they need to be prepared for maybe having more children than they were planning on to go down this road. Because some couples, I think it's okay morally to put those embryos up for an embryo adoption process, but a lot of couples, they have a tough time emotionally choking that down. That's a tough one, because it's one thing to put one kid up for adoption, 3, 4, 5. That's a different matter emotionally.
Yeah. Praise the Lord for technology, but yeah, these are difficult considerations, and thank you for presenting here at the conference.
I enjoyed it.